Hello and welcome to the Functional Solution discussion and podcast. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with us, we have Dr. Chill.
Hi, everybody. Welcome.
So hopefully you're having a good evening so far. It's been nice and sunny here, although cold and windy, but we'll take nice and sunny here in Oregon every day of the year. And I know that Dr. Chill, you're in California, so it's probably sunny there.
It is actually a little rainy. So this is, I guess we're going into a little rainy season in
Oh, I
San
see.
Diego, which is kind of nice. We need it.
Yeah. So it sounds like we switched. We
We
switched our
did.
weather. Yeah. We sent
But
it over there.
I'll need that sunny weather here soon, though.
Yes. Absolutely. It's always nice to have a sunny day, especially in the winter.
Absolutely.
So today we're going to talk about a really important topic, which is natural alternatives to NSAIDs. And every Wednesday, myself and Dr. Chill are kind of bringing together our clinical years of clinical experience in functional medicine, herbal medicine, nutritional medicine, here together and sharing with you some real clinical applications and tools that you can use to help your patients. And if you're interested in learning about more natural approach to NSAIDs and reducing chronic pain and inflammation, then you're in the right place. So there's several reasons why we chose to focus this particular talk of our talk today about natural alternatives to NSAIDs. We know that NSAIDs are one of the most common prescribed classes of medication for pain and inflammation. And when you look at the statistics, there are more than 111 million prescriptions that are written for NSAIDs in the US every year. And they account for approximately 60% of over-the-counter pain medication. So this is pain, as we know, is very prevalent, unfortunately. There are so many Americans who struggle with chronic pain, and they're looking for different solutions. Now, we know that as we age, the prevalence for using NSAIDs is increasing. So with individuals with Americans age 65 or older, some surveys are showing up to like 90% use of prevalence for use of NSAID, right? So if NSAIDs are beneficial for reducing pain, why do we need to learn about natural alternatives? Why would healthcare practitioners know and understand what other natural alternatives are available out there? And the answer kind of goes, there's kind of like probably 2 or 3 different answers to that. One, we know that NSAIDs are not intended for long-term use. And second thing is that the longer a patient uses NSAID, the higher the risk for side effects. So I'll give you an example. In the US, it's estimated that approximately 107,000 patients are hospitalized every year because of gastrointestinal side effects. Another example is the most common reason for hospitalization due to NSAIDs is GI bleeding. And it's reported that in some surveys that every time that a patient hospitalized because of GI bleeding that was induced by NSAIDs, it cost about $15,000 to $20,000 per hospitalization. So it's got a financial cost. It also has a health cost, right? And we're looking at, there's another interesting survey that we looked at when we kind of prepared for this podcast today. This was early 2000, published in the American Family Physician Journal. And they found that among arthritis patients, NSAID was reported to be associated with the death of over 16,000 Americans every year. So that's a lot of patients who are struggling. It's a lot of patients who are getting side effects. This is not just in the US, by the way. It's a worldwide problem or challenge, if we can call it that. And there was a interesting studies published in England in 2016, and they reported that NSAIDs are responsible for 30% of hospital admission due to adverse drug reaction. And common side effects they reported are bleeding, heart attack, stroke, and kidney damage. So this is a big topic. And I know that you've probably been in healthcare. You've probably seen so many patients that are coming in struggling with chronic pain, right? And Dr. Chill, I know that the second reason why NSAID could be problematic is because they don't really address the root cause of what's causing pain.
That's absolutely correct. This is a really great topic to bring up because so many patients ask about these alternatives, and we want to provide them with some options to do these alternatives safely. And that includes what type of dosing, what are you looking for in terms of a length of time, and then while we're looking at the root cause. So there's always a time and a place to help to alleviate and provide short-term care. And then while we do the functional medicine stuff, right, which is looking at the long-term approaches, what are the root causes? And that's why we're kind of bringing up this discussion, because there are going to be times where we do want to help alleviate pain for our patients. And pain can be so severe and debilitating for them. We want to provide them with some of these options, and you will be asked some of these options as well. So we want to give you some of these alternatives to kind of go into how to properly dose these for your patients. Before we go into the first alternative, let's do a little warm-up quiz for you guys. The question is, which of the following is not true about how chronic inflammation causes pain? 1, it increases oxidative stress and damages tissues. 2, inflammatory cytokines irritates nerves. Number 3, it causes nerve activation. It releases neuropeptides that contribute to pain. Or number 4, systemic inflammation always causes pain. Again, which of the following is not true about this? I'll give you a couple of moments here, and you could provide your answers by putting it in the chat if you'd like. All right, great. Well, the answer is 4. The systemic inflammation doesn't always cause pain. So remember, the question was, which of the following is not true about that? With inflammation and certain types of inflammation, like low-grade chronic inflammation in certain types of organs and body systems, it may not produce noticeable pain. So that's something to keep in mind for your patients. Now, let's get into our alternative number 1 for NSAIDs. This is an awesome herb that I often prescribe and recommend to my patients, and it's generally considered safe for many of your patients, and this herb is called curcumin. This is an active component of the traditional Indian spice turmeric. So you may see it interchangeably. It may show up as turmeric on a supplement bottle, or it may show up as curcumin. Just understand that curcumin is the active compound that is in the spice turmeric. And it has been studied for anti-cancer properties, antioxidant properties, anti-mutagenic properties, and what is beneficial for pain is the anti-inflammatory effects. So let's take a look at a really great study that was done on curcumin and pain, specifically for RA patients. So there was a randomized pilot study that was completed, and this was done to assess the efficacy of curcumin, and this is for active rheumatoid arthritis patients. It revealed that 500 milligrams per day, and this was for 8 weeks, what it showed was there was a statistically significant improvement in disease activity score. And this was done through the American College of Rheumatology. And this was, again, The suggested dose for the RA patients is 500 to 1,000 milligrams per day. And the active score was from the American College of Rheumatology score. And if you want to read a little bit more about this study, this was done in 2012 and it was produced in Phytotherapy, and it's called a randomized pilot study to assess the efficacy and safety of curcumin in patients with active rheumatoid arthritis. Now let's take a look at the mechanism so you understand how this works and you can explain this to your patients if they're using this for pain. And this is being shown from the Journal of Pharmaceuticals, and this was published in 2021. So let's pull up this image here so you can see this a little bit more. You can see here that curcumin can impact in multiple different pathways. You see all of these different pathways there. Some NSAIDs and COX-2 inhibitors and curcumin significantly inhibit the expression of COX-2 and activity of NF-kappa. These are the two major inflammatory pathways. Again, that's COX-2 and NF-kappa. Another important pathway that we want to take a look at here in this image is the inflammatory cytokines, right? You're seeing inflammatory cytokines such as IL-6. Then there's also an anti-inflammatory cytokine, which is IL-10, which you can see in the middle there. So what we're seeing with curcumin is that it has been shown to reduce inflammatory cytokines such as IL-6, but it increases anti-inflammatory cytokines such as IL-10. So what curcumin is doing is it's selectively supporting a healthier immune reaction and a healthier inflammatory and anti-inflammatory reaction. We can also see that curcumin also supports the maturation of chondrocytes, right? These are the cells in your cartilage to help with bone structure as well. And these are specialized cells in the repair of the cartilage, as was just mentioned. And if you want to take a look at this slide a little bit more and dive into some of this research a little bit more, you can take a look at this journal called Pharmaceuticals, and the article is called The Immunomodulatory and Anti-Inflammatory Effect of Curcumin on Immune Cell Population Cytokines, and this is in vivo models of rheumatoid arthritis. So here is another reason why we want to look at curcumin to helping with your pain patients. There's a really interesting study that was published in the Journal of Clinical Interventions in Aging. What the researchers did was they took 367 patients with knee osteoarthritis, and they had a pain score of 5 or higher. They randomized them into two different groups. Group number 1, they received ibuprofen of 1,200 milligrams per day. And then group number 2, they received curcumin extract of 1,500 milligrams per day. The study was done for about 4 weeks, and it was a double-blinded study. So patients and assessors did not know which each patient was taking. They found that 1,500 milligrams per day of curcumin extracts were as effective as the 1,200 milligrams of ibuprofen for the treatment of knee osteoarthritis with significantly less GI side effects. So if you have a patient that has osteoarthritis pain, you may want to consider providing an alternative for them besides the ibuprofen of 1,500 milligrams of curcumin daily. And this can decrease their side effect risk, especially with the GI side effects.
I'm so glad that you shared this study, Dr. Chill, because inflammation, this chronic inflammation, is responsible for so many of those chronic pain conditions. We're in this particular example talking more about joint pain, but there's also interesting studies that show that curcumin can also reduce pain due to neuropathy, and other interesting studies that curcumin just has a really wide impact that is very, very important in helping patients reduce that inflammation and that pain. There's a lot, obviously, that goes into it, more beyond what we're talking about right now. So one is the issue of absorption. So curcumin is not very bioavailable. So there's a way to increase bioavailability and absorption. You can add, for example, a small amount of piperine. There's some supplements already include piperine, which is increases the absorption, right? So some studies will already have 5 milligrams of piperine, or some supplements companies call it biopiperine, but there are supplements that already contain this black pepper compound with curcumin to increase absorption. And then, of course, as Dr. Chill already mentioned, the second thing we want to make sure is that we also address the root cause, like what's driving that ongoing inflammation. If it's joint or nerve or muscle, like what's driving it, right? It could be changes in the functional medicine approach. We know that it could be dysbiotic changes in the gut, could be environmental exposure, it could be something they're eating, could be something that they're exposed to in home or in the office. It could be cellular dysfunction, right? There's so many different factors, and that's exactly what we do and what you learn in the advanced and clinical functional medicine program. So this was really, really good. So let's give you another tool that is really, really helpful. And as you'll see, each one of those tools works a little bit different. So the next herbal compound that we are going to be looking into is ginger. This is the natural alternative number 2. And ginger is a spice, right? And it comes from the rhizoma of the plant gingerbeer, and it's native to different parts of Asia. And it has been used in traditional Chinese medicine and Ayurvedic for centuries. Some of the use of ginger is really dating back to the 15th century. And it's really known for its strong anti-inflammatory, antioxidant, and antimicrobial properties. So let's take a look at a really interesting picture of some of the mechanisms from ginger from the Journal of Nutrients. This was published just recently in 2024. So as you can see here, and this is more specifically focused on joint pain, ginger has several mechanisms. It reduces the inflammatory cytokines such as tumor necrosis factor alpha. It also reduces the inflammatory enzyme COX-1 and COX-2. So as Dr. Chill mentioned, curcumin reduces the expression of COX-2, which is one of the mechanisms in which how some NSAIDs work, while ginger can impact both COX-1 and COX-2. It's also reported to reduce oxidative stress, which is really important because every time you have inflammation, you also get an increase in oxidative stress. And oxidative stress can damage our cells, can cause ongoing damage to our cells. If the inflammation is in the joint, it can cause ongoing damage to our joint. If the inflammation is in our nerves or muscles, it can cause damage to our nerves and our muscles. So when we look at ginger, the dosages, like with other compounds, is really, really important. And we always recommend our community members of healthcare practitioners to use the effective dosage that was found in human clinical trials, because that's how we know the safety profile and that's how we know the effective range for those supplements. So there was an interesting study with patients with rheumatoid arthritis, and they essentially provided them with 1,500 milligrams daily of ginger for 12 weeks. And they found a significant reduction in disease activity score and reduction in inflammatory cytokine. Now, I'm going to post the link to the study here. which you can read further if you want. But the dose is going to be typically ranging between 500 to 1500 milligram daily. That's typically the consideration for dosing for patients with chronic pain. Now, if you're combining curcumin with ginger, then we can go at a lower amount of ginger. You can go with 200 to 500 milligrams per day because you're getting some of these synergetic effect, right? With blocking, for example, inhibiting COX-2 and some of the inflammatory cytokines, and both are anti-inflammatory and antioxidants, right? So far we talked about two herbal approaches to reducing inflammation. And the next one that Dr. Chill is going to go into is a different type of supplement, which is not a herbal supplement. And the reason why we wanted to include this third type of supplement is because with some patients, if they are on polypharmacy, right, and they're taking so many different medications, and we want to make sure that we're avoiding interaction with medications, then sometimes going with a nutritional supplement is going to be safer than going with a herbal supplement. So, and again, our focus really is how can we reduce pain through reducing inflammation, right? And that's why I'm wearing my red shirt today, to remind you that we're talking about inflammation, and inflammation, unfortunately, is a major cause for so many chronic diseases beyond pain, right? So Dr. Chill, it's a big topic, and I'm glad that we're giving them options to consider for their patients.
Absolutely. And I love the fact that you also brought up that you can combine some of these options depending on what the patient's needs are, right? This is where you'll need to kind of be a practitioner. And this is kind of like the art form of being a practitioner, is you actually have to understand what the patient is going through, their past medical history, their current medical history, their supplementation that they're currently on, their medications that they're on, and whether you can do a combination of these supplements for the patients. And you want to look at the severity of their pain. Do you want to add in a couple more? So this is kind of where you'll need to utilize some of the art part of being a functional medicine practitioner. Now, with that stated, we wanted to provide you with another alternative. This is more of a nutrition type of alternative for NSAIDs. And before I go into that, we want to do another pop quiz for you guys, just to see what you are understanding with inflammation so far. So the question is, how do we reduce the systemic inflammation and oxidative stress? Is it 1, reducing sugar and processed food, 2, increasing vegetables and fruits, 3, increasing consumption of omega-3s, 4, finding the root cause that drives inflammation, 5, eat more meat and chicken to get more protein, number 6, all of the above, or number 7, all of the above outside or besides number 5? I'll give you a couple of moments here. And now the correct answer, if you answered number 7, all of the above besides number 5, that is the correct answer. Why is number 5 incorrect? Because if you eat more chicken and more meat, this can actually increase your levels of omega-6s, which can change the ratio of omega-6 or omega-3s to omega-6s, which can cause the body to increase inflammation. And we actually dive into that further in the advanced functional medicine and nutrition program on what the correct ratios should be. So you'll get to see that in that program. Now, with omega-3s, this is going to work a little bit differently than the other herbal compounds that we mentioned earlier, right? The curcumin and the zingiber, or the ginger that Dr. Cohen mentioned. The nutritional compound found in fish and seafood and nuts, this is the omega-3s that we're talking about. And we want to kind of show you a specific study that used omega-3s for pain and inflammation. And this was done in the Clinical Journal of Pain in 2018. And it's called high omega-6s are associated with inflammation, nociception, and psychological distress. What they did was they did a cross-sectional investigation of clinical and experimental pain and physiological and psychosocial functioning. And this was completed in 167 adults. The ages were between 45 and 85. They had to meet knee osteoarthritis, a screening criteria to be in this study. Blood samples were collected, and they assessed the plasma of omega-6s and omega-3s of the polyunsaturated fatty acids ratios, and these were determined. And what they found was that in adults with knee pain, a high omega-6 and omega-3 ratio is associated with greater clinical pain and functional limitations. And then they also had experimental pain sensitivity and psychosocial distress compared to the low ratio group. This is why we continuously discuss increasing omega-3s versus omega-6s with the patients. And that's what we brought up in the question as well. So what we're seeing is that higher levels of omega-3s and polyunsaturated fatty acids, these are associated with a lower level of inflammation and pain in conditions such as RA, inflammatory bowel disease, dysmenorrhea, and neuropathy. And then vice versa, if you have a patient with a higher omega-6 ratio, and this is omega-6 polyunsaturated fatty acids, this was associated with more inflammation, chronic pain, and cognitive impairment and psychological distress. What's really interesting is the omega-3 and omega-6s, and we kind of want to show you this through a picture here. What we're seeing here is that omega-6s right on the left-hand side here, these are going to increase your pro-inflammatory cytokines, right? The conosoids, the prostaglandins, the leukotrienes. These are like the IL-6s that we mentioned earlier. And the omega-6s are actually going to have more of a anti-inflammatory effect, with decreasing the inflammatory cytokines such as the IL-6 that we mentioned. And it's important to note that omega-6s are still needed and essential in our physiology, as they contribute to a number of necessary pro-inflammatory functions. And we need inflammation at times, right? It's about having the balance between inflammation and anti-inflammation. But when the issue arises is when there is too much inflammation, and that is the majority of people in the world today, is that there's a lot of inflammation that's going on. And so what we're trying to do is ensure that there is a correct ratio of omega-3s to omega-6s, so it creates an anti-inflammatory cascade for your patients, thus decreasing their pain levels. Now, what dosages are effective for this? We want to go through that as well, so you understand what to recommend for your patients, because often your patients will tell you they're taking a fish oil, but it's not at the correct dose. And if you look at the bottle, the majority of their fish oil is coming from omega-6s and omega-9s, and it's actually causing the opposite effect. So what you want to look for are omega-3 supplementation, right? This is going to be fish oil supplementation at about 2 to 3 grams per day. And this should be about 2,000 milligrams or 2 grams of DHA plus maybe 400 milligrams of EPA. These are all constituents of omega-3s. And this was done in a double-blind placebo study. What it showed was that this dosage for 16 weeks significantly reduced pain score and PPI in patients with osteoarthritis, and this was compared to a placebo. If you want to read a little bit more about that, it is in Rheumatology and Advanced Practice. This was published in 2020, and it's called Fish Oil Supplementation Reducing Osteoarthritis Specific Pain in Older Adults.
Wonderful. And so now you already have 3 different options for patients who are coming to see you and they struggle with pain. And as Dr. Chill mentioned, either you go, even if you're looking at the natural herbal compounds or the more natural nutritional based compounds such as omega-3, remember the mechanisms are different, and it's important to look at the mechanisms because the more we understand about those mechanisms, the more we can personalize, right? A sort of a precision medicine, if we could call it that, personalize the treatment for each patient, right? And of course, in the advanced and clinical functional medicine program, where we first start is looking at the different factors that contribute to chronic inflammation, looking at the lab testing, specialty lab testing that are not taught in primary care, and of course, looking at what are the treatment protocols to provide a more long-term relief, right? Because while this is really helpful for patients, I've seen patients come back, within the 2-3 months mark with now they have 50% reduction in pain or 80% reduction in pain, right? These studies show that there is a significant reduction in inflammation, right? You just got to take it over time. In most studies, it's 3 months, right? Sometimes longer. But we also want to always develop our clinical skills to offer also a longer term solution for those patients, right? And that's exactly what we do in the clinical and advanced functional medicine program. So if you're interested in more information, we got any questions, let us know. We got specific modules, specialty modules on chronic pain and joint degenerative conditions and neurological conditions and geriatric and cardiovascular and women's and men's health conditions. So our program really includes, you're going to learn as you go through the program all these different specialties. So that will help you as a clinician to better understand what's the root cause behind the patient's complaints, and then quickly articulate several suggestions for your patients to help them with their symptoms and their conditions. So I feel like Dr. Chill, we covered a lot. It was it's like 3 major compounds that patients can buy as supplements. And of course, make sure that they buy professional grade supplements that have good quality control. That's something that we talk about when we discuss about supplements. And then, of course, we have ongoing trainings about all of these topics, right? So our goal is really to help you to improve the health and function of your patients and use and have significantly less side effects that is often come with using different pharmaceutical drugs. So Dr. Chill, this was a big topic. I feel like we covered some really good options.
We definitely gave some good options and gave the dosing protocols. So all the practitioners should be very equipped with helping their patients through pain and providing an alternative for them.
Yes, absolutely. And if you're interested in learning more treatment protocols, not just for chronic pain, but for pretty much any chronic condition, from women, men's health, cardiovascular, metabolic, all of those. If you're interested in learning about protocols, treatment protocols for chronic conditions, then I would recommend to look into our Advanced and Clinical Functional Medicine program. We have treatment protocols and specialty classes about pretty much almost any chronic condition. So we hope that you take care of yourself. Thank you for being here, for developing your skills. bringing solutions to your patients that they're just not going to get anywhere else, right? And this is, by the way, one of the major reasons why many of our graduates get paid between $200 to $800 per appointment, because they bring short-term and long-term solutions to their patients with less side effects, right? With a strong focus on improving the patient's well-being, right? So we're talking about vitality, right? Not just being dependent on more pharmaceutical, right? So this is really one of the biggest focus in our program. So thank you for being there for your patients. I also want to thank Dr. Chill for sharing his clinical experience. And I also want to thank our media team and Jacob, who without them, we couldn't have been here with you. So we appreciate you as always. And we love to work with you, help you to develop your skills, and also grow your practice if you choose to. Increase your income, grow your practice. We have multiple business classes. We have coaching. Dr. Chill also offers coaching. He's got tremendous amount of experience in business and clinical, and we had some amazing feedback from our community members. So reach out to us if you have any questions. And as usual, thank you for being here, and take care of yourself.